Hello. I want to really seize this very opportunity to welcome you all, into our this very amazing moment by which we are about to really dive again into our world, our new world. When I'm talking about our new world, I'm talking of a world of beauty, a world of really happiness, a world of joy and tranquilize. When we look around our world today, we are all surrounded with amazing things, a beautiful world. I used to tell people that our world in which we live in, that very world, it is not really what bad. The world is so beautiful. Why? Because God Almighty really has created this world for you and me to enjoy the beautiness and all the natural aspect of this very amazing, world that God has for you and myself. But when we look around, we can see that really through our world, we can see that every corner there is a problem, there is sad, there is stress, there is worry, there is confusion. And we are looking for answers. But the answers doesn't come at hand the way we expected. Today when we look through our whole world, we are fighting or we are running away from sicknesses and diseases. But the good news, we don't have to run away from sickness and diseases anymore. We have to face them. We have to really stand and fight them. And have to overcome them. And the way we can overcome them is whenever we come to really hold an area of answering these questions that I'm about to present to you as you might be watching me today. And the question that I'm about to really hold present, it is something that really comprises our day and day involvement when it comes to life. When we look into our world today, we have been running away from sickness and diseases. But what is the underlying cause of all that we are running away from? I was reading really an article, and the article really says there was a really old, a 59 years beautiful lady. That this very woman really was really concerned about, even visiting her physician. The concern was the mother really died through really what cancer. So as a result, she began to block herself that she doesn't want to really go to the hospital for them to really check something on her, to tell her something that will terrify her. As a result, she keep on really running away from really what? From the news, the fears that will come in that maybe she may also have something that really had really become overwhelming to her mother and the family. She was running away from them. But one thing, if you have a condition and you don't face the condition and you are fearful, you are running away from it. The reason why you are running away because you don't know what you are running away from. We have something that really we need to really discuss. But before we discuss it, we have to really ask a question that is facing everybody in our world today. And the first question is about what is the underlying cause of your sickness and your diseases. One of the main key factors that we would like to really find is what is known as estrogen. Estrogen. So the question comes this way. What is estrogen? Do you know what really entied with the title estrogen? Do you understand? I have about 25 questions that I'm going to ask you today as you are watching me. The first question I have for you, behind this, the first question I have for you is number one. You have to answer them, yes or no. Do you know that estrogen is a female hormone that is produced in the ovarian? Yes or no? If your answer is yes, you can mark it on your mind. You mark it. The second question, do you know how estrogen is being contributed to the following? Number one, your brain. Number two, your muscles. Number three, your bone. Number four, your bladder. Number really what? Five, your eyes. Number six, your eyes. Number seven, your heart. Number eight, your lungs. And number really what? Nine, your blood vessel. These are really what powerful element that we are talking about over here. That is all that really we are concerned about as a human beings. Number one, your brain, your muscles, your bone, your bladder, your eyes, your heart, your lungs, and your blood vessel. In this really foundation here, the question comes this way. The way and the things that we have been running away from is all about diseases that really comprise with these very ones. The blood is one of the things that people run away from. Because really for a medical, somebody will really begin to complain with certain viruses or certain things. When the blood tests show up, the thing that they are concerned about is the blood. So when they are really what, after their white blood cell become very really what, paralyzed, or their red blood cell become really what, poison. They are afraid that they're gonna really get some kind of a really what, something that really will bring encouragement unto them. Your heart condition. When you look around our really what, our world today, people are concerned with the heart issues. Bone disease. When people are aging at a certain particular age, they are concerned with the bone. The things that we do when we are very young. You reach 50, 51, 60, 70, you are concerned with your bone, with osteoporosis and so on and so forth. Lungs, people are concerned with lungs conditions. And then the list just keep on going on and on and on. But the question comes this way. Do you all know that really what estrogen can contribute impartation in relating to really what your blood vessel, your lungs, your really what your eyes, your heart, your bone, your muscles, and your brain? Do you know that is an estrogen? So today I would like to talk a little bit more about estrogen. But before I talk about it, I want you to really give me adequate answers to this very really what subject we are talking about today. Number three, do you know that estrogen has over 400 crucial functions in women's life? Yes or no? 400, not one, not two, not three, but 400 different crucial really what functioning in a women's body. One particular really what agent, one particular really what element, one particular really what sustainable really what tool can block 400 crucial problems in women's life. And that's what we are trying to address this very moment as we are doing this recording. So bear with me. You women that might be watching, you might be listening to me. Hear me clearly. Hear me clearly. The question one more time. Do you know that estrogen has over 400 crucial functions in women's life? Yes or no? If your answer is no, I have a good news for you. If your answer is yes, I have a really something that we have to really find the answer also to make it fully and complete. Number four, do you know that estrogen helps to regulate woman's body temperature? I repeat, do you know that estrogen helps to regulate women's body temperature? Are you among some of the women That will mean often whenever the weather or the season begin to change, then their temperature are going back and forth, hot, cool, hot, cool, hot, cool. Some call it hot flashes. Are you among one of them? That's the question for you. The question is, are you among one of those women? And you know that estrogen do regulate your woman, your temperature. I remember one time when I was at a place and this very woman, we were at a conference meeting, not a medical conference, just a regular conference. And I was really speaking, and this very woman really was with the group. And all of a sudden, this very woman took a fan and began to really fan her really hard. She was so hot, like fire was really on her body. And the rest of the people really, they know, but they don't know the underlying cause about it. The temperature really was going up and down like clock, back and forth, back and forth, back and forth. I have a good news for you. Did you know that estrogen can really work or regulate you as a woman? And even you men, in some cases, your bodily temperature, yes or no? Number 5, do you know that estrogen can prevent eczema? It's a mental health impediment. Did you know that estrogen can prevent what? Eczema? The answer to these very questions are waiting for you. You know it? Great. You don't know it? Then we have to find for the answer. Number 6, do you know that estrogen really what? Can help to prevent damages in your muscles. You young men that we whenever you go to the gym, and you are a women, you go to the gym, you are lifting things, you are building really hot calories, and you are doing exercise back and forth. Did you know there is something out there more that really will be able to help your muscles, to prevent you from losing your muscles? Do you know that? Next question, number 7. Do you know that really what estrogen help to regulate your blood pressure? See, when we are talking about blood pressure, many often people think that only men or the people that are obese are the only people that they have high blood pressure, or people that really, they are really what? Their glucose levels are really mixed up and so on. There is something that they are lacking in their body more than just really what? Sugar issued and so on. Did you know that estrogen can really what? Regulate a number optimal really what? Blood pressure and bring it to really what? That we're supposed to be. Yes or no? Do you also know that estrogen can help to enhance your energy? Did you know what number of women that and men that sometimes whenever they get into a certain particular age, they feel like they are beaten up? Did you know that estrogen can really what? Can boost your energy level? Yes or no? I don't know about you, but before my eye get open about this very kind of amazing revelation, sometimes whenever I get up, I feel like when I was beaten, I was struggling all over really well, because there was a deficiency of something in my body. But since I found that very true, I'm like a fireball. When I get up energetically, I'm really just running on steps, like a really 25 years person, on steps, back and forth, because really something has taken place. The question comes this way: did you know that estrogen can really work, can boost your energy level? Yes or no? Wow. Number 9, do you know that estrogen can also really help to improve your mood and increase your sexual interest? Well, somebody must say, well, do you know what? Many often women or men, whenever they reach a particular age, that is the interest of really what? Their sexual really element isn't really a problem no more. Can I tell you something? I have a good news for you. I've heard so many people that will tell me that, oh, my wife doesn't really enjoy real sex no more. Oh, my husband really doesn't really enjoy sex no more. Did you know the problem? The question is, did you know that estrogen can really boost your sexual interest? Yes or no? I have a good news for you. Those of you who have been watching me, the problem isn't really that really your wife or your husband. Don't blame your husband, Don't blame really what your wife. Don't blame really what being you are old or you are young. Don't blame one another. There is something that really is really what missing, and we would like to talk about that this very afternoon. Wow. Number 10. Do you know that really estrogen can act as a really natural calcium blocker that help keep your arteries open? There are so many people that really want when their arteries blocked. They have to really go and see a specialist to begin to open them up, to begin to really do things on the maintenance on them. It is not the maintenance that we're going to do alone that will be able to open your arteries. But I can tell you something, there is something that really is lacking. So the way your metabolic issue begin to function, something is missing and something isn't working well. It's not a matter of really cutting, opening you up, cleaning you up that can make that everything happen. There is something, a fuel that you need, and that is estrogen. Well, refer that number 11. Do you know that estrogen can aid in the formation of neurotransmission in your brain, your serotonin? Yes or no? Did you know the number of people that whenever they age and they reach a certain particular part of their life, they begin to forget things, their keys, their appointments, the name of their loved ones, their friends and their family members? Are you among those that are really for the family line? Have you been missing your appointments? I have a good news for you. Did you know that really what estrogen will be able to really help your urine transmission? Do you also know that really this very brain that we have on, the brain have really what a communication outlet that the brain urine speak to each other. But for them to speak, there is something that really will energize them. We give them a fuel to be able to enable them to be able to really communicate with one another. And do you know that really what estrogen can help to really do that? The question is either yes or no. If the answer is you don't know, don't worry. We have a good news for you. Number 12. Do you know that estrogen can act on things such as what? Serotonin, which help to decrease what? Depression? Yes or no? And do you know also really what that real what estrogen can really help with what? Irritability, anxiety, as well as pain sensitivity? Yes or no? Number 13. Do you know that estrogen may help to decrease with what? The LDL, which really happen to be the bad cholesterol, and prevent its really what? Oxidation? Yes or no? Number 14. Do you know that estrogen helps to decrease with what? Your liberation, which of course is a risk factor of what? Heart disease. How many father? I was really just here and talking to a Nigerian man that was having some skin condition, and a friend of his also really came into the equation. And as we're talking, I was told that this very coming Monday, he's going to have a heart surgery done on him. They're going to open it up because there was a blockage and that he wasn't sure about it. And the only alternative is really what? To really work on him, carry him up. But the condition is this. Did you know that estrogen have the ability to give us some answers without really what? Cutting? Yes or no? Number 15. Do you know that estrogen help to decrease really what? Accumulation of really what? Plaques in your arteries? Yes or no? Number 16. And there is the place really then that brings us back into really what this very amazing session we are about to have over here. Did you know that estrogen may help to decrease wrinkle in your skin? Did you know the number of people that really, whenever they reach certain ages, they have a wrinkled skin, they have a dry skin, they have itchy skin, they have puffy eyes, and so forth? Did you know that estrogen can block all those things? Yes or no? When you look onto our website, you will see people that they land up really what all information that whenever really take this very really what natural supplement or natural thing and you use them on your face, it will really do this, it will do that, it will do this, it will do that. Those are all wonderful informations. But the condition we are facing, we are not facing the condition on just on the external element like we have been saying. We are trying to really address issues from the inside that will result on the outside. Number 17. Do you know that estrogen can help to maintain your memory? Yes or no? Number 18. Do you know that estrogen can help prevent loss of your tooth? There are so many people, whenever they reach certain age, before they become aware, boom, cavities, and so forth. They begin to lose their really tooth. Did you know that estrogen can help you to really what? Maintain your tooth really what? Consent. Yes or no? Can I tell you something? Your tooth inside your mouth is your beauty. You can see some people that they are so beautiful, but when they open their mouth, they are concerned about it. I have good news for you. You are beautiful, and don't worry. God has some good news for you to maintain that very condition. Number 19. Do you know that estrogen can help to increase the blood flow? Did you know that there are so many people in our world today, really many often, they do have blood clots on and on. And they are really called concerned about certain type of really supplement like vitamin really E and so on and so forth. Many of them are blood thinners and so on and so forth. Can I tell you something? It's a concern. But can I tell you something? Did you know the question you have to answer to yourself? Did you know that estrogen can help or allow your normal blood to flow the way God Almighty made it? Yes or no? Number 20. Do you know that estrogen can help increase the water in your skin, which is responsible for the thickness and the softening of of the skin? Yes or no? You see, there are so many people that they think really they can take really vitamin E's and A's and different things to really help them to keep their skin really very healthy. But can I tell you something? Those ones are good news. But we have the better really what information that really will help you. Did you know that estrogen really can help the texture of your skin, the water content of your skin? I've been telling people that really what, for every part of our body really there's water inside it. So when you become really what, your body becomes so intense, dehydrated in your skin is dry. There is something that is blocking the water in your skin texture to begin to make your skin really become flexible. That your skin will come up with inflammation. Did you know that estrogen can really help you with that? Yes or no? And the last but one question. Do you know that overall risk of heart disease can be reduced with estrogen? Yes or no? Did you know the number of people that are in our hospitals today that they have heart conditions and that they will spend a lot of money? They go in back and forth, and nothing really was working for them. Did you know that estrogen can really hold, can reduce the risk factor of a heart disease? Yes or no? And then lastly, do you know that estrogen can help reduce the risk of cataracts, the eye condition, the eyes condition? There are certain people that they will say, well, oh, their family members really, suffer really, they have, cataracts and so on and so forth. As a result, they also really believe that they're going to go through the same very direction. I have a good news for you. If your mother have a cataract in their old age, don't expect that you're going to really take the same thing. If you know how to balance your really health issues, there will be really a breakthrough for you. That's the condition we are talking about. It is very, very important we have to take good care of our lives and our health. So now the question comes this way. When we are talking about really what estrogen, then this really brings us to really what the open session of really what our discussion. I believe I've asked you about 23 questions what you know about estrogen. Now when we are talking about estrogen, what is estrogen? Study shows us that really estrogen is one of the powerful natural properties for female hormone. When we are talking about really what, there are so many things that will happen in our life today whereby we take them for lightly. Hormone imbalancing can destroy your family, can destroy you, can destroy even your children. If you did not know what hormone does, you are missing on a lot of good things. So when we are talking about really what estrogen, we are saying estrogen really is a powerful natural property for female hormone. Next, estrogen is God's property that really contribute to about 5 things that I'm going to really address. Number 1, your brain. Number 2, your muscles. Number 3, your bone. Number 4, your eyes. And then let me really ask about maybe another really 4 to 8. Number 5, your bladder. Number 6, your heart. Number 7, your lungs. And number 8, your blood vessel. So for you to have ultimate really what momentum of really what your brain, there are so many people today in our colleges. There are so many students that really, unless they are on drug, when they are studying, they could not retain it. There are certain people, they get to a particular age, they cannot retain, they cannot concentrate, they cannot focus. They might be inside the classrooms, they might be studying, but the moment they get out of the classroom, they forget what really they have been taught. They get an assignment and they couldn't really what, be able to really concentrate and function. We've seen these very things on and on and on. Something in your body is not functioning well, and that is known as estrogen. That is known as really what? Estrogen. Now, when we are talking about estrogen, what is an estrogen? An estrogen is a natural, what is known as DHEA. This is DHEA, there are so many really what debates about it, and few studies have been really done about it. But when you begin to really study more about really what pioneers and some of our groups with the anti-aging, and many of the really amazing really organizations, the data really have proved that really what DHEA really have the ability to really combat even cancer. Now, let me talk a little bit about the DHEA. We, the human beings, whenever really we have been born, the level of our DHEA is 100%, including men and women. But women, girls, whenever they reach from the age of 13 through 16 years, then the level, the moment they begin to have their cycles, the level or the ratio of really what their DHEA level begin to decline. And when it begins to decline, many often they won't see nothing about it. The declination will keep on going. You see little people do things that really whenever little young girls, they are between 12, 13, they cannot have mood, attitude and so on and so forth. Can I tell you something? Even though they might not have such a concern like the way adults will have them. But when it comes to a particular age, they start having really their cycles. These very girls go through really what situations just like the way adults go through. They suffer. Sometimes they go through emotional things. Sometimes they go through stress things. Their body becomes really what jammed with a lot of things. Why? because really what the DHEA level in them started really want to decline. And many often whenever it begins to decline, people will not really see it immediately. The only time, the area that we begin to see the consequences of the very declination of this very DHEA is whenever they reach a particular area whereby they begin to get into womanhood, whereby they begin to have hot flashes on their skins. And if they do not do anything about it, when they enter to these menopause stages, from the pre-menopause to really menopause, last minute what they will end up into post-menopause. And there be the place where really hold the whole thing ball out. If we do not do anything about it, from the time we are talking right now, can I tell you something? There's going to be some consequences on the way. It is very imperative that we begin to really get into prevention rather than begin to find curing. No, we really want a DHEA alone. We have what is called melatonin. Melatonin, DC, you cannot really take the DHEA, being a hormone really for property alone to function well. The DHEA and melatonin, they complement one another. You cannot take the one and get all the really for the results. So the DHEA and melatonin, they work together as an element. Now, whenever we begin to look at our condition we are talking about on the skin, I told you way back on our lectures, probably number 4, that many often the people who do really have skin conditions, they have a lot of inflammation in their bodies, in their skin. If you cannot really sleep well, you do not really get, at least 8 hours of sleep, you are depriving your skin. You are depriving your body. Your body will eventually become inflammable. And before the flame take place, something might be going on inside. And if you do not do anything about what is going on the inside, can I tell you something? It will backfire, and the result is what you're having on your skin. It is very, very imperative that we have to know some of these very things. So let's go a little bit further over here and talk more a little bit about really what the benefit of really for the DHEA. Now, according to studies, scholars agree that really what the DHEA is the most abundant steroid in the human body. So in another word, whenever really you have your DHEA and your DHEA level have declined, you're gonna have a problem out there. Studies also really have showed with some data indicate that the DHEA is a vital important hormone in the body. Next, it protects every part of the body against revenge of aging. So you are fighting aging. You are dealing with aging issues. You have a mom, you have a pap, you have a granddad, they are fighting these very things. The question comes this way. Somebody must say, well, how do I begin to really deal with this very thing? If you have never taken DHEA in your life, then I have a news for you. You have a DHEA deficiency. A blood test has to be really what? Applied. And let your physician begin to really help you in these very areas. There are so many people that they keep on saying that DHEA really is a really risk. Can I tell you something? If you take them excess, they can cause a little trouble for you. If you don't know what really you are dealing with, that is why it is very, very important for you to connect with anti-aging physicians who are trained, especially in these really hormone elements, like myself here. When you get really poor, you Google or you dial for American Academy of Anti-Aging Medicine, you will see about 120,000 anti-aging physicians that they have been trained on bioidentical hormone across the United States, across the world. You will get them, including myself over here. The whole goal over here is we want to educate the public for them to know that, well, you know what, we can prevent diseases rather than we allow the diseases to begin to really visit our home before we begin to push it away. It is too late for you to do that. If I look up to my age, as I'm standing or sitting in front of you right now, the energy level is incredible. I walk out, I tell people my age, they don't believe it. When I show them my driving license, say, are you kidding? I say, yes. One time over here, there was a physician that really, we were just over there, and really he was taking coffee and I was taking green tea. And he asked me, why do you take really green tea? I said, because of my age. He said, how old are you? And I took my driver's license and I gave it to him. He said, are you serious? I said, yes. Is that the treat? I said, yes. The green tea has made the trick. It has caused a breakthrough. You know, when you are taking really what is very DHEA level, can I tell you something? It will do a miracle with your life. It will take really what you very further. Next. Now let me show you the consequence of the deficiency of the DHEA. When you have a deficiency of the DHEA in your body, you will have immune dysfunction. You have immune dysfunction. Today I'm not going to talk too much about immunity, but next time I'm going to talk about how our immunity, our immunological aspect play a role in our body. When your immune becomes very weak, and I tell you something, you'll be subject to everything, every disorder that just fly all over the places. Look at religious money that even they have been spending on every word. A fluidia, just common something that really they can stop it just like that. And cold. Every year they spend a lot of money, give all these shots, and people are suffering. Why? Because they have lacked what is supposed to really introduce to the public. They have lacked that very one. Education is what really we are lacking when it comes to our health issues over there. Because really what? We fail to take a good properties into our bodies, into our system. Like a very good example that I can give you, have a vehicle. And you cannot be driving a vehicle for really what? A year without checking the oil inside that very vehicle. The engine is very important so far as that very vehicle goes. Your engine oil is very, very necessary. Your transmission oil is very, very necessary. If you are not careful, you take your transmission oil and put it into really what? A place where you're supposed to put really what? Your regular oil, you will blow your vehicle. The same way when it comes to the human body is the same way. They have been putting a lot of wrong filters into the system. So flu doesn't fear those very things, cold doesn't fear those very things. It's just like the way President Clinton put it in a very beautiful term. He says it's just arithmetic. It's just arithmetic. If we could use a proper really wisdom, we will overcome so many things that really we have been, we are talking about here. Now, so let's look at really what the deficiency of DHEA can really what correlate with really what chronic inflammation. Did you know the number of really people that are suffering chronic pain in this United States alone, and the number of money they have been spending on really what chronic issue, pain issue, from the athletes to the really what the youngest. People can walk from here to really what maybe real downtown, and before they get back home, their legs were already cracking them. Why? Because there is something going on out there. When you go to real international places, people can walk so many miles without cars because they are not toxic. We are around a pollution, fume all over we are inhaling these very things to our system. So we are packed with inflammations. These things really, we have to put a stop to them. And we can. You can, I can. If we work as a team, we will overcome these very obstacles. So whenever really you become DHEA deficiency, you might have a chronic inflammation. One of the things also really that really one have to be concerned about, whenever really you don't check your DHEA level, you'll be depressed. There are so many people that really, they are really what? Depressed every really what? 6 months. People do say that we people in the really what the state of Pennsylvania here, because sometimes we don't have a very cloudy weather and so on and so forth. That is why, depression become rampant in this area really. Can I tell you something? Yes, we need vitamin D and so on and so forth to help us. We need a sunny weather. But can I tell you something? We have something more than just vitamin D. You need something more than just really what? A gloomy, beautiful weather. If that is the case, that really whenever you have a sunny weather, you don't have to get depression, then can I tell you something? We have to close our really psychiatric ward with antidepressive really protocol. We have to close the place then when the weather becomes really what? Beautiful. Sunlight. That is not it. There is something that is missing in the body. And that is known as what? Your hormone property called the DHEA. Not with that alone, rheumatoid really what? Arthritis and osteoporosis. All are factors, risk factors, and so on. Type 2 diabetes, complication. If you did not really do anything about it, those are all really what some of the factors out there, the risk factors over there. Cancer is one of the really what? Risk factors over there. Excess body fat is one of them. Cognitive really what? Declining, that is the brain, is one of them. Heart disease in men in particularly is one of these very elements we are talking about. Like the way I said, osteoporosis. Now let me really just give you a key element over here about when we talk about osteoporosis here. The word osteoporosis really came from the Greek, word. The word pros means bone. Pori means disease. So, osteoporosis means really what? A bone disease. Now, you might be watching this very thing and sometimes you might be saying you are a Christian and you have been quoting Isaiah chapter number really 53 and verse number 4 and 6, somewhere there, that Jesus took all our family, he took all our diseases, and by his stripes we were healed. You quote these scriptures many times, but still when you quote them, nothing was working. Did you know what? You have only done one part of the equation. The one part is the spiritual side, but what are you doing on the physical side? You are lacking the DHEA in your body. So it takes really what? The spiritual side and the physiological side to make you get optimal level. Next. Now, when we are dealing with this osteoporosis issue over there, I felt very strongly that because of the lack and the deficiency of DHEA, when really this very kind of a really what? Your marrows and your bone density, they did not get the fuel such as the DHEA in your body. It really will suppress your bone density. I was really reading an article about really what vitamin D. Yeah, vitamin D is so very, very important. Vitamin, what we call calcium, is a part of really what? But can I tell you something? That alone cannot cut it. None of those very good vitamin D and vitamin E, they can really fix the answers without really what your DHEA. It's a part of it. It's like you have a car again, and you have the engine. You have really what? Engine oil. You have a transmission oil. How would your really what car go if your battery is dead? You might have really what? Your transmission oil, you might have your engine oil, but if your engine battery is weaker, you might have the positive and negative. You can really crack everything and jump them and whatever it is. You might be saying that, oh, it might be really what transmission problem, oh, it might be really whatever really. Can I tell you something? It might be just because of that very battery that you are lacking there. And that's the way, so really your vitamin D, they could be like your cellular system for your body. Vitamin D is good. Calcium is good. But can I tell you something? Each and every one of them complement one another. But can I tell you something? Don't allow anybody to deceive you that really what? You don't need vitamin D. Can I tell you something? Vitamin D is very important for every human being on the earth here. The most people that they need more vitamin D in their life are blacks. It doesn't matter whether you are from Africa or you are from America here. They need really what? Vitamin D more in their system. Why? Because whenever really what? They are the result of what? The deficiency of vitamin D is the cause of many of the really what? Obese that we are seeing today. You talk to your doctor about it. that they should check your vitamin D level. You check it. Because they are from really what? They need a lot of sunlight. Because they were born from the sun, really what? They really have a lot of sun. So they have a lot of vitamin D over there. So whenever you are in the country where you don't get a lot of sun, can I tell you something? You will have the vitamin D deficiency. So you have to boost your really what? Your vitamin D level more. And with the help of God, together with prayer and with your DHEA, you're going to have some amazing really what? Breakthrough and deliverance. Now, so let's look at really something over here. We have been told that really what? Physicians across the world, they know that giving estrogen to women and testosterone to men during the midlife can avert symptoms of depression. So in other words, only few, but any physician really can tell you about really what? Estrogen and also really what? Testosterone. Now when we are talking about really what? Testosterone, with the men, whenever really you are grown, you are young, you have this very testosterone really what? 100% pack. When you get into certain really what? Age stages within your life, then they also begin to really decline. So all these other things, blood tests have to be really what? Checked and make sure that everything is numbered. A good example, like whenever it has reached a time of inspection of our cars, it has been stated that every year in Pennsylvania here, our cars have to be checked. They have to inspect the car. Whether the car is a brand new car or old car, according to the law in the state of Pennsylvania, you have to take your car into a place for them to check this very car and make sure that they put a new sticker on it. Why a new sticker? They want to make sure that really what? You are safe. You can buy a new car in 1 year. If you did not really check it and the police get you on the road, can I tell you something? They will stop you and they will fine you. Why? When they stop you, will you tell them that it's a brand new car? They won't listen to you. They will give it to you. And you see somebody with an old car and they will take their car to the mechanic, department, and they will really work on their car and they put the stickers on them for them and they are driving and no police will harass them. But can I tell you something? You might have a brand new car. If you did not a year, then you did not really check the expiration due date on the sticker on it, you'll be in trouble. You are driving, you are looking around back and forth where the police is coming. The same way is with your health issue. God wants you to know that really He has really made these very things really work. Amazing for you, so really work. Estrogen is very necessary for women and men. Testosterone is very important, and whenever really you become to really have these very things up in your body, it will nullify the symptoms of depression. If you have been having a lot of depression and you don't know what we are doing about it, let your physician check your estrogen level, being a woman, and also really men, your testosterone level. These very things are all really essential with our body. The good news, then this really brings us back to really what our session today. People know a couple times, maybe about 4 or 5 times now, we are giving lectures about really how your skin really can live in a better beauty world. We have a really amazing products. And can I tell you something? There is an amazing thing about it. Now, but before I get into that, let me tell you something. Study shows that with DHEA has a powerful skin protection effect on the body. DHEA. So whenever really you have the DHEA, your optimal level of DHEA become accurate in your body. Can I tell you something? Your body, your skin can be protected as well. There are so many people that they will take a sunscreen and they will go in the sunlight and they are bathing themselves over there and they are bending themselves over there and they say they want really want vitamin D. Yeah, that is good. But what wisdom did you apply whenever really you are on the sunlight over there? You say you want a tan skin. Yeah, that is cool. But can I tell you something? Have you ever thought about the HEA?